And how many people have better vision in the morning? Hands? Yeah. Well, there's lots of different reasons why, but some of the vision in the morning stuff is that in the morning you've just got more energy. It's easier to focus. It's easier to see. You're more relaxed. And then as you start looking at things during the day, if you're nearsighted, the muscles tighten down. How many people get off the computer and their vision's blurrier, far away? Hands? That's an example of why it's better in the morning. When you've used your eyes, the muscles tighten, and guess what? They don't release, and your vision's blurry. So, here's the Jebrock computer wiggle. You want to learn the computer wiggle when you're looking at the computer? Okay, you ready? You're looking at the computer. You take a break. You look far away. And you each take your two fingers behind your ears. And you're looking far away. You're breathing, you're blinking, you're moving your fingers closer. And as soon as you notice your fingers in the periphery, that's what you want to do. You want to open to your peripheral vision. So blink, breathe, and take peripheral vision breaks. Open it to the periphery. Do that regularly, okay? That could save you from going nearsighted. Oh, I just call it the wiggle. Can you go to the next slide? Funny we started speaking about that. The single most repetitive motion involves the muscles of the eyes, computer users, not the hands. Symptoms can include intermittent clearing and blurring, eye strain, discomfort. Prolonged eye muscle tension can result in permanent loss of distance vision requiring glasses or surgery. Computer stress causes people to see less, do less, and generally be less efficient. So that's the same thing. Your eyes stay focused on that screen. The light is, cycling, I think, at 60 hertz. So you've got a flashing light flashing at you all that time you're looking at it, which is unusual. Most reading, the light's reflected off a page. This is a light flashing on you. And then the fonts on the computer are such that your eye really can't identify where the font is. So there's a constant muscle spasm searching for where is this distance, where is the font, because it appears to come from behind where it really is. So you've got this computer muscle spasm, and they call it a computer eye syndrome, where muscles spasm and vision clears and blurs. Then if it stays that way too long, it stays blurry far away, and you've lost your distance vision. So everybody using a computer should have a prescription that relaxes the eyes for the computer. That's glasses specifically for the computer, because it relaxes your eye muscles. And then all of the other things you want to do to release your eye muscles. Okay. Next slide, please, Brian. Eyes, vision, and fear. Not finding what you're looking for and not wanting to look at what you see. I think that's a big deal. I think a lot of deviations of seeing are based upon fear. We'll talk a little more about it. Next slide, please. Visual stress. How many people feel like they suffer from visual stress? Anybody? A lot of people. A lot, amazing amount of people. Remember, visual stress and the eyes are such high oxygen processors that you really want to do everything you can to get your eyes flexible and strong. So discomfort, headaches, blurred vision, lower performance. Lower performance means you have to go back and reread all the time, things clear and blurred. Eyes burning, fatigue, sometimes poor memory of what you're looking at, are related to a heavy vision load in the near and/or perceptual and emotional tension. Next slide, please. We won't get this all in at one time. We could start with the top. This is a general stress response. I include this because it reminds me of all the work that we're doing with EFT, how important it all is. And this is based upon just a perception of some threat, some fear. If you could raise it up a little higher, Brian. You've got these systems. The HIPAC system, which is the hypothalamus, pituitary, adrenal cortex, cortisol, corticoids, etc. And you've got, just from perception and fear, you've got all of these changes going on. Fluid loss, inflammation. Can you raise it up a little higher? A little bit to your right, Brian. And long-term chronic effects of just fear and perception of stress. Immune system, atherosclerotic changes, depression, blood pressure, insulin, obesity, lipids, blood, bones, blah, blah, blah. You look at the other system, the sympatho-adrenomedulla system, adrenaline and noradrenaline, and their effects, increased heart rate, respiration, blood pressure, plasma, FFAs, triglycerides, blah, all the way down, long-term chronic effects, fast heart disease, platelet problems, cholesterol, triglycerides, the list goes on. And then you wind up with potentially all of these things that have some potential effect from stress. Hypertension, heart disease, stroke, diabetes, cancers, ulcers, GI problems, allergies, arthritis, and we should certainly include vision problems. Can you go to the next slide? So with stress, emotional stress, things you'll see in the eyes are dilated pupils. Eyeballs that protrude a bit, eyes that dry, lagging lid, higher pressure in the eye, more difficulty focusing. If you have more difficulty focusing, you've got to work your eye muscles harder. When you work your eye muscles harder, it's greater stress, causes greater changes in the eye. Exophoria means eyes want to wander out. Low adduction means it's hard to turn them in. And just a general slowing of ocular activities. That's just perception of stress. Just. So, I think that in large part, all of these different eye conditions can happen. Nearsightedness, farsightedness, astigmatism, suppression of one eye, crossed eyes, wandering eyes, circulation changes that lead to eye problems, that lead to cataracts, that lead to glaucoma, that lead to macular degeneration. Big stress factor is loss of peripheral vision. How about if we all just play this game for a second? Everybody make 2 holes in their hands, small like mine. Hold them up to your eyes, and they're tiny holes. Now, when you have 2 small holes and you want to see something, what are you going to do to see something? You're going to try and probably move your head around to get more information because you can't take it in too much, right? Okay. Start opening up the holes a little bit. Feels like a relief, doesn't it? Okay. We see children who come in the office, and this is not limited to children. When we measure their visual fields are sometimes this big. In other words, they're walking around taking in this amount of information. And these are some of the same children that are categorized as ADD, who are constantly bouncing around in the class, trying to take in information. And we have a really good treatment for that. We use color to stimulate their eyes, different colors, depending upon how their eyes are working. That opens up their visual fields. But the cause of this contraction, and this is not a disease, this is a functional contraction, this is some sort of stress. The cause of this is almost always emotional stress. So another thing that causes attentional problems, and that is very measurable, are these contracted visual fields. And we're measuring visual fields all the time. But they're happening with us too all of the time under stress. Our side vision contracts. We don't see. We get too narrow. Stress does that all of the time. But I say anybody working with attentional problems in children needs to consider visual stress and emotional stress because it contracts their fields. And if you can open their fields, you'll get big behavior changes. I would like to stop here and teach you an exercise that I think is very good to do. Let's see. Why doesn't everybody stand up and stretch for a second to start? And in fact, give yourself a little room and let's do a little swinging technique. So a swinging technique, let's do it with the eyes in mind. What you want to do is you want your head, make believe there's a paintbrush on the edge of your nose, so your head is just rotating and things kind of move around, jump around like you're on a train. Okay. Good. So I'd like everybody to do this one. Now this is one of my favorite things to do to make your eyes stronger that you can all start doing. Pick out a background when you're doing this, maybe the white screen or something that's got a good background. And the purpose of this is, first of all, to make sure your brain's operating both eyes. So it's a check-in. Because does anyone really know if both of their eyes are feeding into their brain right now? No, not really. I mean, in the office we've got all kinds of little toys like these 3D glasses to tell us and instruments that only part of the field is visible by one eye and the other. So this is a quick check to do that. So the first thing I want you to do, and the purpose of this is to check that and also to just get your eyes to release and relax a little bit from a different way of seeing. So hold a finger close to you, maybe 6-8 inches, on some sort of background that's clear. And the first thing is that you want to see as you're looking far away. Don't look at the finger directly. You're looking far away. And if you see 2 fingers, so most of you will see 2 fingers, some of you won't. You're looking far away. So most people have 2 fingers? Yes? Good. Okay. No. Okay, now some of you won't. If you don't have 2 fingers, it means that at this point in time, your brain is only aware or processing with one eye. Okay? Try and wiggle it to see if that'll get you 2 fingers, those that don't have it. Move it a little bit. Move it closer, your finger. Move it further away, but your eyes are looking far away. Moving the finger closer. How many people don't have 2 fingers still? Hands? Just 1 finger? Yeah? Okay, it must be that you're not using the background must be precluding it. If you're looking far away, close one eye, you'll see 1 finger. Close the other eye, you'll see 1 finger. Keep both eyes open, and you'll see 2 if it's processing at the same time. How many people do have 2 fingers? Yes. Okay, good. If you don't have 2 fingers for now, see me later, and I'll see if I can check it out later. So it's all right. If you only have 1, stay with 1. So you've got 2. Now what I want you to do is I want you just to swing your head. You're not looking at this finger. You're still looking far away. You're swinging your head, making believe there's a paintbrush at the edge of your nose. And you're noticing the fingers out of the corner of your eye still moving in the opposite direction of your head as you move. You're not looking at the fingers directly. Can you get that? Nice and easy. Soft. Breathe. How many people can see that? Hands? Yes? Good. Now I want you to close your eyes, and I want you to visualize that going on, moving your head, seeing the fingers move in the opposite direction. Just doing the same thing with your eyes closed. Yes? Do that? Good. I'd like you to do that. I'd like you to practice that. That simple thing tends to release the eyes, very simply. Now, next part. Next part is what I want you to do is now I want you to look directly at the finger, and hopefully you'll see one if both eyes are pointed at it. Everybody got one? Anybody have two fingers? Two of me is good. Two of me is good. One finger if you're looking at the finger. Now, what I want you to do is I want you to paint with the paintbrush on the edge of your nose, is paint your finger, and let your eyes follow the paintbrush down. Just paint it up and down. Now close your eyes and paint it with your eyes closed. Okay? That solidifies two eyes working together. And now I've got one more piece. This is a little trickier. The first one is to relax your eyes for far. This next one is to stimulate your eyes to do better work for focusing for reading. So this is what I want you to do. Does everybody have those first two all right? Yeah? Okay. This is for reading now. Hold one thumb behind the other, one at arm's length, one in the middle. What I want you to do is look at the closer thumb. Let's call the closer thumb thumb A. Everybody see one thumb A? See indirectly if you could notice two thumb Bs. Yes? This is a good group, my goodness. Now here comes the next piece. This is where it gets a little tricky. What you're doing now is you're having your eyes focus closer than where you're looking on the next step. So now you're going to take thumb A away. Not yet, wait for me. You're going to take thumb A away when I tell you, and you're still going to look at nothing. You're going to look at the air, the space where thumb A was. You'll know you're doing that because you'll still have two thumb Bs separated in the same way. And that's what the game is. As soon as you take it away, you want to look exactly there. Easy, very easy. Can somebody keep it there? Keep two thumb Bs? Little while, great. That takes a little practice. That'll be homework. Because it's a reaction to look at something rather than nothing. But I want you to be great at looking at nothing. So you take it away, you have two thumb Bs. And then, as you look closer to you in midair, the thumb Bs separate. And as you look further toward thumb B, they come closer together. And I want you to be, this doesn't happen necessarily right now, but that control will improve all of your reading abilities and all of the farsightedness for reading. And in fact, if you can do that, that'll be one huge step toward keeping your eyes stronger for reading for the rest of your life. That's a trick. Okay?
What was the last part of this last one?
The last part you're taking away the thumb A, you still have two thumb Bs. They're separated by a certain amount. Then, as you imagine your eyes looking closer in space still toward thumb B, the thumbs start to go back together. So I want you to be able to control your eyes to the point where where you're looking closer and the thumbs separate more, and bring them back gently and still controlling it very gently, back and forth. And then when you read, try looking a little closer than the page. It'll stimulate your focusing muscles. So you might even see double on the page initially, because you're going to look closer than what you're looking at. Got it? It's like an aha. It takes a while.
It didn't work.
Yeah.
It's really clear.
Right. Now I'll tell you that story for me. It took me, with my eyes, when I started doing that, 1 year to be able to do that. I cried, and then I saw depth after that. I mean, that was a huge deal for somebody who has a serious impairment of using his two eyes. Questions about that? Yeah.
Should you do it without your glasses?
I'd like you to do it both ways. It'll be real different with and without your glasses. It may be, too hard without, but it'd be good to try both ways. Yeah.
Is this, in a way, is this the opposite of doing a magic eye picture?
Yes.
Where you, okay.
Yeah, and use the magic eye pictures for distant stuff, The only problem with the magic eye, you're still holding it and looking up, close. But I like this idea of getting double on the finger and doing some sort of swing, just to break up the pattern of seeing.
Okay.
What's the magic eye?
Magic Eye was a book of pictures and diagrams that were made off-center so that if you look past it, you'll get a depth reaction. 3D. Posters too, right, which is great. Okie dokie. We are ready to take a break. I think I can cover more ground and be helpful to you by answering questions that people had, because people have asked me such wonderful questions that I think would generalize to a lot of people. So what I'd like is for everybody or anybody who wants to make a comment or ask a question to maybe line up in front of the mics and we can try and answer them and teach that way. So I'll start over on the left side. Say your name just so I...
My name is Linda. Hi. Would you please comment on floaters?
Yes. Oh, God. Floaters. Boy. I'm going to try and make my answers short but helpful. Floaters are typically in the vitreous chamber, which is the big chamber behind the eye. And they're real common. As you start getting over 50, the vitreous chamber changes. And the vitreous breaks down. And then frequently it detaches from the retina, which in itself is usually not a serious problem, but it could be a very annoying problem. So here's the thing. There's an emotional component to floaters. The more stressed you are, the more obvious the floaters are, typically, mental stress. And whether or not that precipitates floaters, nobody knows. But you want to be tapping on relaxing, releasing. You want to be doing peripheral vision. You want to be staying away from noticing the floaters. Don't stay tuned in to your floaters, because they can drive you crazy. Colored lenses, when you need them, are a really important thing. Colored lenses diminish the apparent floaters. So even indoors, if floaters are bothering you temporarily, hopefully and usually most floaters, due to gravity, settle down, change shape, go to the bottom of the eye, and they get out of your life. Occasionally they don't, and occasionally if the vitreous detaches, it can pull on the retina and cause a retinal detachment. Not usual, unlikely, but here's the differential diagnosis. If you've got a lot of flashes of light, a lot of floaters, big ones, and loss of vision, that's an immediate phone call because it could be a retinal detachment. Otherwise, the usual run-of-the-mill floaters, tap on them, get rid of them, tap on anything you can to relax, colored glasses to diminish their obviousness, and don't stay focused on them too much.
What color?
Colors, I would say in general, what is most relaxing are colors in the blue spectrum. So I would suggest using blue, even pinkish blue, but that's not great for an outdoor sunglass. So if you're trying to do something for both, maybe a light gray might accomplish both, just as a thought. Okay? Yes, wait, I'm going to this side.
Oh. I have a question and a comment.
Yes.
The question is, in the dream state, I'm a dream analyst, so when you're dreaming, and the question
dreaming
is,
already.
yeah, do your eyes focus the same way in the dream state while sleeping as they do in waking state? And if so, around emotional dreams, nightmares, that kind of stuff, what are your eyes
Right.
really focusing or
Right.
not?
Right. Well, first I have to tell you, I've thought about this for many, many years, and I don't know the exact answer, and I've tried to find out, and it's not clear. But so many times, the eyes certainly focus with thought and emotion. So it would certainly seem to me likely that the inner muscles, the focusing muscle is working, although I don't know that for a fact. Certainly there are, rapid eye movements during different stages of sleep. And certainly some people wake up with their eyes feeling exhausted, as if they have been working very hard. So to answer your question, I'm not sure, but I think there's a lot of focusing muscle activity going on.
Thank you.
Yeah, you're welcome.
The-
In fact,
the-
I'll try and find that out again. Thanks for
Yeah.
bringing that up.
And the comment is,
Yes.
2 weeks ago, I had some energy work done with a friend who I really don't know what she was doing, but she was just doing this energy stuff. It's called the Ewing method. And I had this cloudy feeling over my right eye. And during this energy session, it moved away. My eye just actually opened up.
Yeah.
And I didn't think too much about it until I started to read the road map coming here and realized I could see it absolutely perfectly with no
Wonderful.
lenses.
Wonderful.
So something is going
Something's
on.
happening, yes. Great, thank you. Oh, yeah, my peripheral vision got lost on that side.
I was just, it's not on. Okay, I just wanted to ask about the pinpoint glasses, and if you...
Pinhole glasses,
Pinhole
yeah.
glasses, if you advocate
Yeah, I
those.
have a quick comment. At one point, we did a little study with pinhole glasses. Everybody know what the pinhole glasses are? Pinhole glasses, for those that don't, were a pair of eyeglasses that were opaque, mostly, but then they had a whole bunch of holes poked in them. So when you look through them, you're looking through lots of pinholes. And the pinhole principle is that when you make a small hole, you eliminate the peripheral rays of light that would be out of focus in your eye. So if you put them on, you could, even people with strong prescriptions can see through the pinholes. You had less light, but you could see. And the idea was if you wore them, they'd make your eyes better. And that was being advertised on TV for quite a while. But that wasn't true. The statements weren't true. It didn't really make your eyes better. But on one level it did that I want to share. Because you took them off, some people saw a little clearer for a short period, if at all. With them on, they could see. But here's why they were good, and still may be good to use. If you're wearing eyeglasses all of the time, nearsighted eyeglasses, farsighted eyeglasses, there's a certain contraction and strain of the eyes in just looking through the glasses. The glasses, like nearsighted eyeglasses, make things smaller and make your eyes turn in more and make you contract. That's why I don't like glasses. I like contact lenses a lot better than glasses, which flies in the face of all the natural healing, but there's a lot of reasons why. Point being, if you give your eyes a rest and take off your glasses, the muscles relax and you could still function using the pinhole glasses. And just by relaxing the muscles, giving your eyes a rest with pinhole glasses, sometimes people's vision would improve. So that's the way that pinhole glasses would be helpful.
Hi, I'm Kathy, and I just have a quick pragmatic question. How would I get a hold of those shaping lenses, and how would I find someone in my home area that does the kind of work that you do?
Yeah, well, it's called orthokeratology, so you could do some website stuff. The caution is that a new company just started marketing a lens. They're trying to commoditize it and make money on it, and they're advertising. So a lot of the doctors who are using it may not have much experience because they're trying to train the doctors. The lens is okay, but not as good as some of the other lens designs. So look under orthokeratology, take my card and stuff that's on the table, and I have a list of doctors that I know around that I could steer you to, perhaps.
Great,
And
thanks.
like that.
Thank you.
Yeah.
Can you hear? Yeah, okay.
I can hear you.
With the idea that we have different modalities that are stronger, and I happen to be more of a kinesthetic and audio
Right.
person. I talked to you about this
Yes, I
before.
remember.
And so I'm curious about your opinion about whether or not perhaps at some point my visual modality was affected because of some event that I don't know about that made it weaker, or if my brain is just wired differently and that's why I'm more kinesthetic and audio.
You know, the answer is I don't know, but I certainly think that both are possibilities, and either is a possibility. I really do, because I've seen that where people will shut off their vision and work with other modalities, because that's just what they've chosen to do to survive, you know.
And when you see that in children, because sometimes you can see that at a very young age.
Oh, yes,
in children in
absolutely.
school, that could have been happened to them too.
Absolutely.
If that's, yeah.
Oh, definitely. Which leads me to the next. I have something I want to offer you and how to improve your inner imagery. Boy, that's a 2-hour lecture. We're going to do it in 2 minutes. Anybody interested in working on that?
Yeah.
Okay. Let's do this, because this is really good and it's easy to do. Get a partner for this, real quick. Get a partner. We've got to cover cataracts and macular degeneration, the two epidemics. So don't go until I talk about those two. All right. And then we also have a holistic dentist in the audience that I'd like to hear from. Where's John? At some point. Okay. Who works with eyes. Okay. So one of the things about imagery is you want to develop imagery. And somebody declare they're an A, and somebody declare they're a B. Okay. What I want you to do is I'm going to just demo this for a second. The idea is to talk for 2 minutes nonstop about what you're seeing with your eyes closed. And the idea is you want to hear your voice, because hearing your voice stimulates the imagery. Good question. I'm getting there in 1 second. The first way I want you to do, now some of you will have no problem. You'll cover your eyes. I like to cover mine with my hands. And I have a program going on right now, because I'm seeing something. I'm seeing, I don't know why it's dark right now, but it's late at night. I've got this guy in a canoe. The canoe is kind of, it looks like it's a taupe color. There's a guy in the canoe, he's rowing. There's some weeds that are on the high, tall grass on the left. Guy is rowing down the stream. I now see a bird. It looks like a big black bird flying, and it's bright. The sun is out. There's some trees. The sun's coming up over a hill. Okay. Don't ask me why. Don't ask me why. But there's frequently, and you can develop, if you already don't do this, because about 1/3 of the people do this naturally. They close their eyes. They've got visual stuff going on. 1/3 have to develop it, and another 1/3 will say, I don't see anything with my eyes closed. Okay? So now, usually, if you don't see anything with your eyes closed, you usually do. You just don't realize that you're seeing. So first of all, for everybody doing this, if you don't see anything with your eyes closed, what you could do is just start by picturing your house and describing your living room and start talking about it. The goal of this is to simply practice talking about what you're seeing with your eyes closed. Now, some people still might not see anything there for a while, in which case, describe the blackness. Now, right now, I'm looking at my eyelids. I see little flashes. They're scintillating up top toward the nose. I got a flash going on here. It kind of looks like, oh, I'm seeing a face. Okay, so just describe anything that you're seeing with your eyes closed. And you want to practice it for 2 or 3 minutes a day, because you'll increase the vividness of your imagery. And somebody did a study, it was Win Wenger in one of his books, who's an educational doctor, who had people do this process called image streaming. How many people do this already or heard of this? Yeah, okay, quite a few. His studies showed that IQ testing, unrelated to any test questions, improved dramatically. 2 Midwest universities. So anyway, why don't we just try it for a second? And what you want to do, if the A's start, the B's look. The B's, I want you to watch their eye movements underneath their lids, because typically, if you're seeing, your eyes are moving around under the lids. Yeah, take your hands, thank you. Don't use your hands for now. It's very hard when your hands are there, unless you've developed another talent. Another course, right? Okay. So, okay, we're going to start. We'll clock 2 minutes. And basically, once you start, you just want to describe what you're seeing, whatever it is, nonstop. Okay, we're going to start now. You're all doing good. 1 minute gone. Keep talking, you guys. Keep describing what you're seeing, even if it's black. Look for gestures that your seer is making because he's imagining it. You want him to be seeing or her to be seeing. Okay, 5 more seconds. You did good. 2 minutes are gone. So how was that for people? Did most people see something with their eyes closed? Yeah? Hands, people are seeing? Now for those who could not see anything, a couple of little tricks. Just to get into it, you just want to start the ball rolling. Describe your house. Do a guided visualization, like take yourself down a path, come to a door and open it, look what's inside, kind of shock yourself, open up a window, come to a wall, look around it in your mind. Just keep surprising yourself to trick yourself into seeing. And let's switch partners to give the other people a change, and I'll tell you another way to use this. So now the partners switch, and we'll do 2 minutes. Start now. One minute. Okay, good job, everybody. I saw a lot of seeing going on there. Okay, so a quick note. Let me just show you. If anybody wants to learn more, the name of the man who invented this is Win Wenger, W-E-N-G-E-R, and the procedure is called image streaming. And he's got lots of stuff to teach about that. One other note, when you do this now, if you practice this for yourself, what I did for a month was I sat down on my living room floor. I lie down on the floor, put my feet up on the couch, covered my eyes, and I took a tape recorder, and I set a frame for myself, whatever I was working on. It could have been how to be more loving, or whatever it was. I've forgotten different things. And I just sat and I image streamed. I set the frame of what I was wanting to work on, the intention. And then I just recorded all the images that were coming to me. And you'll always pull out a few jewels from your imagery that way. But the idea is to let it really free flow. And to work your way into that, sometimes you got to guide it. So do whatever it takes to get there. It reaches different stages. Okay? Win Wenger, image streaming. Good. Who am I up to? I think I'm on this side? Yeah.
I'm Yvette, and
Yvette.
I have 3 questions. One is a little longer, too short. When at night, when I'm tired, I find, without knowing, I find that one of my eyes is closed when I'm reading in order not to see double.
Yeah.
And also, it tends to tear.
Mm-hmm.
But I don't know at which point I close my eye. All of a sudden, I realize that it is closed. So I'm wondering what exercise I can do to
Yeah.
get both my eyes working.
Okay, great, yeah. What you describe is a common thing, and the reason why the eye closes is because it's too tired to work
Yeah.
with the other eye.
Yeah.
And that's the reason why you'll see some people who have obvious what they call strabismus, where one eye will really wander out or turn in a lot, because the brain can't operate the two. Sometimes doing exactly what I just said with these 2 fingers can bring it in. And then also, after you've done that, paint it with your nose to solidify too. Frequently, in the office, if you were there, I would use prisms and lenses and have a bunch of instruments to stimulate it and so forth. So try that, see if it brings you relief, and probably you'll want to work with somebody who works with binocular vision a bit. It's usually easy to train.
Okay.
Usually, yeah.
Okay, my other question is
Yeah.
I have 2 different colors when I close one eye and the other, 2 different shades.
2 different hues that you're seeing.
Hues, yes.
Yeah, that's real common.
Okay.
Not to worry about it unless it's new, in which case some cataract could be causing that or some other opacity, but frequently even young people without cataracts have 2 different colors.
Okay, and my last question has
Yeah.
to do with lenses. I had read a long time ago, and also in a Touch for Health class, heard about different colored lenses that could be used for emotional corrections.
Oh, yeah. You hit
And
my
I
favorite
can't find a
subject.
place to find out where to get them.
Okay. In my office, there is 2 or 3 light instruments, color instruments, that go for 8 hours a day. And we use color and light for a lot of things. This is a full day to 2 days about color and light. So the short answer is like this. We use color and light to make the eyes work together. We use color and light to stimulate peripheral vision. We use color and light if people's eyes turn in. Typically we'll use yellows and oranges. It makes eyes turn out. If people's eyes turn out. Blue, green for eyes that turn out is a good light, good stimulus. We use colors for emotional release work by stimulating colors that aggravate people to bring up stuff. We use colors to calm people down when they are aggravated and can't deal with that. The basic thing, one of the basic rules of color is that the colors from red to green are stimulants, and the colors from green to blue and violet are relaxants. And there are all kinds of people making lenses and different kind of color stimulators. I have one man that makes instruments for me, color stimulating instruments that have flash rates that have really beautiful hues to them. It's about, I think it's about $450, which is one way. But there are inexpensive glasses, plastic ones. They're not as good because they let lots of different colors, like even a yellow eyeglass lens that's inexpensive. Frequently you'll have all kinds of colors coming through it, so it's not as pure. But even those are helpful. So what I would encourage you to do is, one, my good friend and student and teacher, Jacob Lieberman, who's written a book called Light, Medicine of the Future, talks about color, and anyone interested in it should read it. The College of Syntonic Optometry, SYNTONIC, optometry is devoted to the use of color and light for healing. And you could find out where they are, College of Syntonic Optometry. And if your eyes are wandering out, use blue-green. And if people have an interest in color, I would be happy at some point to do a color workshop for people. I love working with color for healing. Okay.
I ended up with tearing of retinas and then developed macular degeneration in one eye, and originally tested that it could be for toxin service. So I was just wondering if anything...
Could be from, I'm sorry.
Toxins, petrochemical toxins and things like that, because I changed jobs, and about 6 months later I was working where at the site of an old filling station. I know that things were spilled and things like that were not taken care of. And I didn't know if there was anything in particular that would help this cause, or what you had to say on macular degeneration.
And so the main problem now is macular degeneration,
Yes.
Is that correct? Yes, thank you for asking, because I've got a lot to say about it. Recently, a man who was the CEO of a big steel company, who's led a very privileged life, and the best of everything, his own pilot, his own beautiful place, and a very sweet man in addition, who could have anything that he wanted, had macular degeneration. Well, he got it about 3 or 4 years ago. And he had his private pilot fly him to Johns Hopkins, Wills Eye Institute, which are excellent eye hospitals and institutions. And they basically tried to stop some leaks with lasers, which is common treatment. If the leaks are too close to the macula, there's problems, because if it hits the macula, you lose everything. And so there's always some risk. I'm going to make a long story short. He had laser surgery, lost a lot of his vision as a result of the laser surgery. Whether or not it improved his situation is questionable, because it could have and it could have not, you never know. And he wound up in my office because his daughter was doing vision therapy, and he was a very cynical man in a certain way, but nobody had done anything to help him see better. And so the first thing I did, and I'm saying this because it applies to your question, is that we put prisms on both eyes, prisms in the same direction. And what that does is it puts the image on a different part of the retina. So we went on a search to find the best part of his retina, number one, so he would know how to use that and find that spot. Immediately, he was able to recognize my face, which was a miracle. Then his other problem was he couldn't see well. He had this is a serious macular impairment. This is like he had to be led around for certain circumstances. Then the next thing that we have done and do routinely is we prescribe light and color stimulation, because all those cells in the retina are responsive to light and color. That's what they're made of. Those cells are not pain cells. They're light cells. So you want to stimulate anything that's alive, maybe not working too well, and we'll use typically yellow and green light, sometimes blue light if it's inflammatory. And light and color, very important. Then you also involved with that is training the person to use a new spot on their eye and how to see with it. And we'll have them, typically one thing that works very well is using their nose to start painting, because it starts to focus in this new spot on their eye, how to go line up their nose and paint with a paintbrush. All these things enhance vision. You want to work with EFT and deal with all the fears about macular degeneration and any other fears that you have, and get to a place where you can try and mitigate the charge on it, because getting the energy in the right direction is, of course, real important, because that all affects the retina. One more note. I've been using lately these glasses that are micro-stimulation glasses. They look like a pair of glasses, and they're battery operated, and they put out currents for stimulation. And basically, I haven't worked with it much, but the doctor who wrote the book is a guy named Kondrot, K-O-N-D-R-O-T, who calls it miracle cure, and he claims many, many people have improved their macular degeneration by improving circulation with these micro-stimulation glasses. And when you put them on, you get a little tingling, you get some images, flashing images of light. I can't say firsthand, I haven't had enough experience with it, but I'd certainly explore it. Okay. Hello.
Hello. Could you elaborate a little on the eye movement theory from NLP, accessing cues and stuff like that?
Yes. I want to back up to talk a little bit about eye movements in general. I had a patient come in. He was real fast metabolism, thin, wiry, handsome, bony man. And he was nearsighted, maybe 4 or 5 diopters. We shaped his eye. We got him to see without lenses, trained his eyes. But we had one real big problem. It was a huge problem. If I would say, follow my finger, if I look at my finger, I'll move my eye. If I'd say, follow my finger, what he would do, I'd move my finger, he would move his head. He couldn't move his eye at all. I mean, I've never seen anybody who couldn't move his eye at all, I mean, without a frank paralysis, a neurological problem. But he could not, because when he moved his eye, he would be in absolute fear and terror. I mean, I'm talking about a little eye movement. So, I'm going to give you a brief answer, and then I want to do another little training procedure for people, because this is very good. God, we don't have too much time left, huh? Briefly, what I like to do, if we're training vision and visual memory, I like people to look up, because sometimes it helps with their memory. In regard to other eye movements, what matters to me more in my practice is getting the eyes free and feeling where there are blocks. So why don't everybody stand up, and we'll play a quick little game. I know I'm getting you up and down too much, huh? No? It's all right. Okay. All right. So let's just call this an extreme eye rotation. Here, the game is this. This is now a feeling game. What you're looking for are the areas that feel tight. The areas that feel tight. So you might do it one eye at a time. Like, for example, when I'm over here, it starts to get scary. I don't know why. I've worked on it a lot, and I've gotten a lot better. But when I'm out to the right, that was my weak eye. Something happened over there. It's scary on my right. So let's make a big, you can hold the thumb pretty close, make a big circle, and just feel where the areas of tension are. Where it doesn't want to go, where it jumps, where it sticks. Yes, you're moving your eye, you're moving your thumb and looking at your thumb for this. So you're really watching your thumb. Now close your eye, and this is for training purposes. Follow your thumb with your eye closed, and then periodically open it and check if you're anywhere near your thumb. Not bad. Good, let's do the other eye. Anybody have any areas that feel tighter? Yeah? What areas feel tight? People want to share? Close up. Close up, uh-huh. High, up. Up is common too. Down and left. Okay, so you find an area, you look for some remindance of what that feeling is. When did it feel that way before? Tap on it, move it, get it free. That's the job. See what comes up emotionally if there is anything. Get it free and as loose as you can, okay? So you're using the feeling as a feedback. And in fact, with all vision training that we do, anytime we're using a prism and someone's eyes double and it goes together, the next question, I'm just teaching you this for training, is what did it feel like? What did it feel like? So that you can just feel these movements and do them by feeling without having to hold up anything. When the two eyes are synced together, what did it feel like? What did it feel like when my eyes released? You want to try and always associate the vision act with a feeling. That's the pièce de résistance, so that you just create the feeling or know the feeling. There's a lot more about NLP that I'm not an NLP practitioner, but that's how I use movement and eyes. But I do very much like to have eyes moving up for processing and memory with vision. It helps. Where am I? Cataracts, okay. Basically, with cataracts, what you want to be doing is antioxidants. Antioxidants that probably everybody is doing, C, E, A, the usual run-of-the-mill stuff. Same kind of stuff, circulation to the eye. The other part is movement. Movement of light with the pupil moving up and down, because that moves fluid around the anterior chamber, which nourishes the cataract. So you basically want lots of pupil movement, which means light flashing, sunning where you're creating different intensities of light in front of your eyes. And the incidence of cataracts goes up with people that wear glasses. And the reason why, I believe, is that there's less movement of their eye, because actual focusing and shifting and moving causes circulation improvement in the eye. So it's the same thing. You want movement in your eye. Focusing movement all the way around. And then antioxidants, bilberry, protect against UV, because UV does cause cataracts. However, if you have enough protection of antioxidation, you can tolerate UV, but I think UV is an issue. I didn't used to think so much, but I'm more and more protect against UV. Hats, sunglasses, and bright light. And the usual green foods are the healthiest. Okay. Let's see. I'm going to move to. I think I'm going to move to here because I'll see if I can grab you again. All right? Yeah.
Hey, my name is Cheryl, and I have some practical questions about these. Now, until I was in my 40s, 20/20 vision, and then I needed some reading glasses, and then in the last 10 to 15 years, the distance vision is a bit different. So with someone who's, they've stayed stable about 4 years, even with a head injury, so the sight has not changed. But in doing these exercises, how often do you do them, the ones you showed us before? And when do you know it's time to do something different about the glasses? I mean, how do you judge that?
It's time to do something about the glasses right away, because the goal is to lead your eyes. So if you're actively in training, you want to lead your eyes to where you want them to go. So I would consider doing that right away. And as far as doing the training procedures, even if you just do it a couple of minutes a day, just a little bit of consciousness. The consciousness with eyes, unconsciousness is huge. Most people have been losing their vision for years. They don't have a clue. They're using one eye. They don't have a clue. So the beginning is just some awareness of what's going on by doing some of these exercises, per se, and start leading it right away. So you want to go to a doctor who's going to want to start leading you in the direction you want to go. Okay? Yeah. I use EFT every day on myself and on my patients in the office. I use it when things come up when we're working with their vision. And that's how I'd suggest you use it with any way that you can. There's no magic tool. You all know how to use EFT, and I would use it in every way possible.
I wanted to make sure that everybody knew you can also do this by phone.
Oh, yeah, yes.
You have people call you from...
Oh, thank you for, yeah.
Yeah, okay.
We have, basically, if people want to work with me, what I would usually ask you to do is get some information about your eyes, like an exam, that has certain measurements that I could look at, have the doctor send it over. And then I would kind of tailor, looking at what I see, a program, send you some instruments, and talk with you and get you some printed material so I can work with some people on the phone. Working in person with somebody is always better, but, well, not always better. But anyway, I'm happy to do that. It looks like it's 12 o'clock. I have some cards over there if people want to contact me, and some propaganda about how we make you see better. And I really appreciate being here. Thank you.